Warning: the following information is pertaining to what I am learning in class. If there is any information that is inaccurate to what you know, I am not responsible. I am in a vet tech program, so all included info will not pertain to human medicine. I am not a professional, nor do I claim to be. This is my desperate attempt for study, even for my exams. Alright. Pharmacology Unit 1. First, we're going to start off with some terms. So, pharmaco means drugs. Pharmacology is the study of how medicines work. Pharmacotherapy is medical treatment by drugs. Pharmacokinetics is the study of how an organism affects a drug, focusing on the movement of the drug into, through, and out of the body, or, to put it simply, what the body does to the drug. Pharmacodynamics is the study of the mechanisms of drug action and involves understanding the interactions between the chemical components of living systems and the drugs that enter those systems, or what the drugs does to the body. So, what is a drug exactly? A drug is a medicinal substance that is used to remedy or change a living organism. There are two categories we can further break a drug down into. A therapeutic drug, which is a drug that is used based on a diagnosis, and a prophylactic drug, which is a drug for prevention. So let's talk about the regulations of these drugs. So first we have the FDA, which is the Food and Drug Administration. Well, what does the FDA do? The FDA enforces laws about drugs. They make sure that drugs are marketed correctly and that they're safe when used as labeled, and they're also responsible for drugs and food. And the only important aspect that we're focused on with that is the withdrawal time. So they came into effect in the 1930s, and prior to the existence of the FDA, there was an act in place that was known as the Pure Food and Drug Act. So the FDA can further be broken down into the FDCA and CVM. The FDCA is the Food, Drug, and Cosmetic Act of 1983. This act ensures drugs are tested correctly for humans. Next is the CVM, which is a subset. This is the Center for Veterinary Medicine. This ensures testing is safe for four-leggeds. So, how can we obtain drugs? You need two things first. One of them being a VCPR, the other one being a prescription, which you can only get a prescription after you have this VCPR. So, what is a VCPR? A VCPR is a veterinarian client-patient relationship. VCPR is only established when the following are achieved. The veterinarian has assumed responsibility for making clinical judgments. The client has agreed to following the vet's instruction. The vet has sufficient knowledge of the animal to make diagnoses. The veterinarian is available, and the veterinarian provides oversight of treatment, compliance, and outcome. Also, an important step, the patient records are maintained. So, what is an extra-label drug or an off-label drug? These drugs are not specifically approved by the FDA. These can include the use of drugs for animals that are labeled for humans. The act that allows us to use the drugs off-label is the Animal Medicinal Drug Use Clarification Act of 1994, or AMDUCA. So, let's move on to over-the-counter drugs versus controlled drugs. What's the big deal of those? So, over-the-counter drugs are drugs that don't have significant possibility for toxicity. These drugs are labeled for specific species and must be used as labeled to avoid toxicity. And these kind of drugs you can get from like CVS. It's like ibuprofen, for example. So, controlled drugs are drugs that are considered dangerous due to the potential for abuse or misuse. The control is simply meant for the restriction on humans, and these drugs are regulated by the DEA, and they are ranked on 5 schedules. Schedule 1 is a drug that is most likely to be abused, or a drug that is most abused. An example could be fentanyl. Schedule 5 is a drug that is least likely to be abused, So controlled drugs must be behind something locked with authorized users and strict record keeping. So, SCRIPS. What is it? It's South Carolina Reporting, Identification, Prescription Tracking System. SCRIPS is meant to collect data from South Carolina on controlled drugs to improve the state's ability to identify and stop the abuse of controlled drugs. It is required by law to enter the info of the owner that is sent home with more than 5 days of controlled drugs for only the schedules 1 through 4. Stages of veterinary drug development. There are a series of tests mandated by the FDA, and there are only 4. So the first one is synthesis and discovery. So synthesis and discovery, these are the preliminary studies done on models, on computers, on numbers. These test if the drug is toxic or not, and the desired target can be tested in this step. Step 2 is safety or effectiveness evaluations. So these are preclinical studies, and they're done using lab animals. This can test short-term side effects or long-term side effects. So long-term trials will last 3 to 24 months, and short-term will be shorter than that. These tests are looking at organ responses, damage to repro tracts, carcinogen effects, or teratogenic effects. If the data during these trials are good, an INAD can be asked for and submitted for approval. The INAD is Investigational New Animal Drug. Moving on to step 3, submission and review to the FDA. So this step is basically where all the info that you have gathered through the preliminary and the preclinical studies will be submitted to the FDA, and then to each of these, like the EUP, the EPA, APHIS. This is where your information will be submitted to for approval. So if it is a pesticide, you will fill out an EUP, which is Experimental Use Permit, which is then submitted to the EPA, which is the Environmental Protection Agency. The APHIS is Animal Plant Health Inspection Services, and that's usually if it's a biologic or a vaccine. Step 4 is post-marketing surveillance. So this is controlled by the drug company and the government. And this step is only followed as long as the drug is produced and marketed. This is where the drug is monitored for side effects and ensures the safety and effectiveness of a drug. And this is where symptoms can be caught 5 to 10 years later, like carcinogenic effects. There are steps for the movement of drugs. The first step is absorption. This step is for any drug that is not the IV. Drugs will absorb from the site of administration into the fluid part of the body that will then carry it around the body. Some factors for drugs are pH, molecular size, and solubility. Some patient factors are age, health status, genetic factors, sex, and species. Step 2 is distribution. This is bioavailability. Bioavailability is the percentage of the drug administered that goes into circulation. Factors that influence this are membrane or the pores in the membranes, tissue perfusion, protein binding, and the volume of distribution. Tissue perfusion is the amount of blood or fluid in the area that moves through the body system. Protein binding factors are drugs that bind to proteins, and volume distribution is the concentration of drugs in the body. Less fluid, less distribution. Step 3 is biotransformation or metabolism. This is just where the drug is metabolized. So the primary site is the liver, and secondary sites are the kidneys and small brain. Step 4 is drug elimination or excretion. This is just how the body removes the drug. The most important route is the kidney. The kidneys controls making urine, and that's one of the most common routes for excretion, or at least the most important to know. Elimination through the kidneys is through filtration. Blood pressure could change how the drug's eliminated, along with renal failure. Elimination through the liver, through the bile ducts, and be excreted into the duodenum and the GI tract. The other routes of elimination are through the milk, sweat, saliva. Other terms to be noted are withdrawal time, which is the period of time from when the drug is administered to when it takes for a drug to leave the body. This is concerning food producing animals like cattle who produce milk or meat. It's important to know because we can't consume that meat as humans if it has that antibiotic residue. It wouldn't be good for us. Half-life is the time required for the drug to be reduced in half. And steady state is the point at which the drug accumulation and elimination are balanced. And that's all for Unit 1.